And that particular story sets the tone for our conversation this evening. We're talking about courses and qualifications there. And joining us this evening on Sunday Express is none other than the CEO of the Kenya Medical Training College. That is Dr. Kelly Oluoch. Welcome, sir. Good to have you on board. The last time KBC Channel 1 was right at your premise during the shift. So it's good to have you in the studio. Karibu sana.
Thank you so much. I'm happy to be here today.
All right. Now, that particular piece has just put the matter into perspective. There are those who feel that our tertiary institutions are not doing a very good job in ensuring that the graduates are market ready, and they feel that unemployment gap or rather skills gap. What's your take?
I'll take the case of Kenya Medical Training College. KMTC is a state parastatal under the Ministry of Health, charged with the responsibility of training human resources for health for the ministry and for counties and by extension for external markets. Kenya Medical Training College is suited to provide competent human resources for health, not only for local consumption but also for other countries through labor mobility. We do that by ensuring that we have competent trainers. We make sure that we have curricula that are properly reviewed to reflect the needs of the healthcare sector in the Republic of Kenya, and also to reflect the global healthcare needs. As an institution, we also ensure that we have the proper equipment and skills laboratories that enable us to produce the very best of human resources for health who are competent.
So for you, is that the model that you have has you working at plugging the current deficit that we're having in as far as medics? You've talked about medics and such, but then I would want to know further, at a time when students are quite, conscious about employability and the quality. With the numbers that you have in terms of those who are seeking their studies to further their studies under KMTC, what is unique about KMTC that we keep getting the records of new students?
KMTC produces over 85% of human resources for health,
yes,
who work in private sector and in public sector. The demand for graduates of Kenya Medical Training College continues to rise, not only locally but internationally. KMTC has uniquely molded itself to create a competitive advantage to supply the most competent human resources for health. We do that through several strategies. Number one is through ensuring we're able to offer more than the medical courses. For example, we offer foreign languages that allow our students at their last final year of study to be able to prepare for job markets in various destinations where they have chosen to go and work after completing their training at Kenya Medical Training College. For example, we offer German, we offer French, we offer Arabic. Now we are offering and preparing to offer Amharic.
All right.
And that allows us to create opportunities for those who want to work outside the country.
So beyond the usual nursing or other courses, you're also doing value add, so to speak. So before we speak value add, address the issue of brain drain. We see in as much as we are training our graduates a year in, year out to qualify to plug this particular gap that we're having in the country, they are qualifying, finishing their studies and seeking employment elsewhere. How do we ensure that we do not continue losing this human resource that is very well trained, as you've said?
I view labor mobility in various ways. I see it as a way of also enriching our level of understanding of global health scenario. As Kenya Medical Training College, we have expanded our infrastructure, the number of campuses we have, to create opportunities for more learners to apply and be at Kenya Medical Training College. Currently, we have 92 campuses. Last year alone, we graduated 22,776 graduates. And at the same time, last year, we put in our admission 34,000 new learners in our institution, courtesy to the President's agenda of ensuring we have infrastructure, we have tutors, we have the equipment that we need to ensure that we offer competent human resources for health. So we want to assure the country that we are capable of producing human resources for health for local and international consumption.
So from where you sit, sir, for you, labor mobility is just one of the ways to enrich our capacity, so to speak. There are those who view KMTC as an institution that solely does, or rather focuses on or rather human resource trained for the medical field, so to speak, especially nurses and nursing. Can you unpack that? You know, you've talked about languages and such. Can I apply for another course to study something else other than nursing from KMTC?
KMTC offers 126 courses. Can you imagine that?
Wow, I only knew of
nursing is just one of them.
One of the 120?
Yes,
okay.
126.
126.
In Kenya Medical Training College, we have, apart from nursing sciences, we have pharmaceutical sciences, that is pharmaceutical technology. We have diagnostic sciences faculty, and under this, we have medical laboratory sciences, we have medical imaging sciences, we have health information and technology, we have health records and information technology, we have medical education. We have preventive and promotive health. So here we have health promotion, we have public health, we have health counseling. So Kenya Medical Training College offers courses that are tailored for primary health care in line with government's agenda and the Ministry of Health's agenda to ensure that we are able to prevent diseases before we are able to start treating them, and therefore reduce the amount of money we use for curative purposes. When we use 1 shilling at primary healthcare level, at preventive level, we are able to save 9 shillings at upstream during curative services. And that is what KMTC is gearing towards, to make sure that we train health workers who are able to work at the lowest level, community level, and ensure that we reduce costs emanating from healthcare.
Now that you've talked about the community health nursing, we understand that you have partners like the World Bank and Beyond Zero. What does this really mean about how does it impact, you know, with aligning with Kenya's real health needs, so to speak?
We have programs like what we call Enrolled Community Nursing, which is a certificate course which was tailored to ensure that arid and semi-arid areas of this republic are able to access health personnel who are able to manage conditions that could easily cause death. For example, we have currently a situation where previously 15 counties in arid and semi-arid areas of the Republic of Kenya were contributing to 90% of maternal, newborn and child mortality in the Republic of Kenya. Because of collaboration with partners like World Bank and these counties, Kenya Medical Training College has been able to train 1,544 enrolled community nurses who are able to work at very remote areas of the Republic of Kenya, thereby enabling access to healthcare to the most vulnerable in the remotest part of this country. Through that means, we have been able to work with counties and other partners to significantly reduce maternal and child health. Child mortality in the Republic of Kenya.
With your partners, the working with your partners has increased your capacity. And now talking about capacity, you mentioned that you have now 92 campuses. When someone hears 92 campuses from KMTC, what comes into mind is the human resource and the equipment, you know, required to ensure that these particular campuses continue to met out the training, or rather learning as it should be in that capacity. So how are you ensuring that there are no staff shortages and the equipment or the campuses are equipment ready?
His Excellency the President and the Ministry of Health have focused on ensuring that KMTC is properly supported budget-wise. For example, as we talk right now, we have through the affordable hostel accommodation, what we call student villages. We have a plan underway to ensure that 57 of our campuses have improved hostels and new hostels for students. We have, through the support of the Ministry of Health, been able to put resources to be able to employ more human resources for health. And we also have a lot of strength when it comes to partnership with counties. And counties have supported by seconding additional staff to Kenya Medical Training College to support training of human resources for health.
So I think, Dr. the question of understaffing and lack of equipment for you is just something that people talk about. That is good. Now, we have a recent development in regard to that particular matter, is that KMTC higher diplomas have been equated to a bachelor's degree, right? And how does this strengthen, career progression and also confidence, from middle-level training, looking ahead?
First, it allows our graduates to easily access competitive employment that enables them to perform at levels that allows them to access promotions at workplace. Second, it allows for progression academically that enables our graduates to access higher education because of higher diploma that they have achieved at Kenya Medical Training College. And third, it is a way of enabling the country access specialized human resources skills at remote parts of this country. You are very much aware that specialists at higher levels like master's level are concentrated in our urban centers. Yes. But our graduates at higher diploma who provide alternative support for specialist areas work with the communities and therefore improving access to service delivery, improving access to specialized care in these areas, and therefore improving the quality of care that our Wananchi are exposed to.
All right, that brings us to our first break in this candid conversation. Remember, you can get us on our socials as well as we are streaming live, so you can keep tabs of this particular conversation. We are engaging none other than the CEO of KMTC there, with 92 campuses, all fully equipped, no shortage in terms of human resource, and saying that indeed this is an institution to watch in the future. We take a quick breather. When we come, we need to know how this then, what it really means in the medical value chain, other than the medical value chain when it comes to matters of employability in the country. We'll be right back. Welcome back. As we bring this conversation to an end, we'd want to hear from our guest this evening, the CEO of KMTC. In where we're finding ourselves, Dr. Kelly Oluoch, we're finding ourselves in the era of technology. Is KMTC equipped, to train its students in light of this change in ecosystem?
KMTC is well placed to provide training and future-proof our graduates when it comes to technology. Just to state that last year, KMTC won the CIO 100 award, Africa Award in digital adaptability. We also got an award, the first runners-up for tertiary institutions, that is including universities, when it comes to making available internet resources for learners across all the institutions, tertiary institutions in Kenya. Now, KMTC does this by ensuring that we have, number one, simulated laboratories. Simulated laboratories enable our students and learners to be able to simulate real-life experiences in laboratories to enable them to learn more about various conditions that affect human beings. Secondly, we have embraced technology like ERP. Our students are able to access their marks, they are able to access their fee payment status, and all the operations of the institutions, both core and non-core mandate of the institution, are on a platform. Okay. We also have a very robust e-learning platform that enables our learners to be able to actually access materials online. And also we also have an e-library that allows our students to access learning materials remotely, even when they are not at the campus.
So there's no worry about AI. Now, as we bring this to a close, this is the last question. We've been having a challenge in the quality of education that is offered across some vocational institutions, so to speak. From where you sit, would want to hear, is there a day in time that degree holders, certificate holders from KMTC will be worried that what they invested in, in terms of time, education, is going to be watered down because of policy or, such issues, so to speak? Give us that assurance as we bring this to a close. And also, maybe you can tell us, in the future, what does it portend for KMTC?
Kenya Medical Training College is one of the most regulated institutions of higher education, because all the regulatory bodies in the framework of healthcare regulate the training at Kenya Medical Training College. That ensures that as we train, we adhere to the highest standards of quality. Besides that, Kenya Medical Training College courses are accredited by KNQA, and all our over 96 courses are properly accredited to enable us to be able to translate them even at international levels. KMTC is also ISO certified institution, meaning that all our quality management systems are accredited. And with that, we continue to ensure that we embrace the strictest level of regulation to make sure that our courses remain relevant, remain as per the framework of training at the ministry and framework for training for the education in Kenya.
So we shouldn't be worried as parents and those who are seeking to join KMTC?
I want to assure you that Kenya Medical Training College sticks to the highest levels of standards.
Any chance of getting duped when I'm seeking admission in this particular institution?
Currently, Kenya Medical Training College is carrying out its admission, and the deadline for admission is 6th of May. And we do this in collaboration with Kenya University Central Placement Services. And I want to warn the public of those who may want to dupe them, because admission at Kenya Medical Training College happens through the KUPS platform, and no one should tell you that there is another way of getting admitted at Kenya Medical Training College. Make sure that you go to any of our campuses, and in collaboration with KUPS, we will be able to support anyone who wants to seek training at Kenya Medical Training College. If you are in doubt, please ask and make sure that you get support from the nearest KMTC campus. We are lucky to have 92 campuses across the Republic of Kenya in 45 of our 47 counties.
All right, very well said. We have been discussing courses and qualifications, and our guest in studio has been none other than the CEO of KMTC there, that is Dr. Oluoch, and that brings the end to our conversation this evening. Remember, further details are available on our website.